Hello students, today let us discuss about basic concept of clinical biochemistry. Introduction. During the last 25 years, medical schools have extensively integrated the teaching of basic science, including biochemistry, into the clinical world. It is now rare to find a medical school curriculum in which biochemistry is taught in isolation as a vast array of reactions, chemical mechanisms, and metabolic pathways dissociated from the normal and pathophysiological processes involved in human health and diseases. Despite the current diversity in form of medical curricula, the content is now solidly oriented in a clinical context. As such, many courses in biochemistry, particularly those located in or associated with medical schools, have a need for teaching materials in which biochemical concepts are articulated and developed through presentations of specific examples of human disease. What issues need to be considered for clinical investigations? With the increasing complexity of modern medicine, we now have literally thousands of possible investigative techniques at our disposal. We are now able to examine our patient's serum and every other body fluid down to the level of individuals' nucleotides, as well as being able to perform precise imaging through computed tomography, CT, magnetic resonance imaging, MRI, and other imaging technologies. The problem we have all faced, especially those senior medical students or junior doctors, are which test should we use in a given setting? What hazards are associated with the test? Are there any situations where specific tests should not be used or are likely to produce erroneous results? As medical complexity increases, so also for investigative course. Many assays available today are highly expensive, and wherever possible, we would ideally like to use a test which is cheap, reliable, reproducible, and right for a given situation. Such knowledge takes many years to acquire, and it is a fact of life that senior doctors who have attained such knowledge are not usually those who request the investigations. So we need to revise our ideas and to incorporate new advances, particularly in molecular biology and in gene therapy, and to integrate more coherently into a comprehensive presentation of medical biochemistry. At the same time, new areas in the clinical field have been emerged, such as investigative importance of collagen structure for osteogenesis imperfecta and mitochondrial metabolism for mitochondrial myopathy and reverse cholesterol transport for Tangier disease. Importance of clinical investigations. In clinical biochemistry, clinical pathology and clinical chemistry are all the subject of studies. These are all branches of laboratory medicine in which chemical and biochemical methods are applied to study for disease. So we should always perform the case study followed by a brief diagnosis, which includes a brief discussion of differential diagnosis and criteria needed for establishing the diagnosis. For example, discussion about hyperhomocysteine provides recent insights on the effect of impaired metabolism of sulfur-containing amino acid metabolism on vascular disease. Apart from this knowledge on nutritional biochemistry, including protein-calorie malnutrition, obesity, vitamin A deficiency, calcium deficiency, and iron metabolism will give us insight about the ideas on day-to-day basis of our balanced diet. Format for laboratory and diagnostic tests. Nowadays, the laboratory and the diagnostic tests of any test are presented in a consistent format designed to focus on what is important for the healthcare provider. The following format is used for each test. 1. Name of the test. For this, the primary test name is given, followed by other commonly used names and abbreviations. 2. The test description. The description provides a foundation for understanding the test, its purpose, how it assists in the diagnosis of various conditions, relevant physiology, and the meaning of results in conjunction with other tests which might be performed. 3. The evidence for practice. When available, relevant evidence-based practice guidelines have been included to assist the primary care provider in clinical decision-making. Discussion about evidence-based practice can also be included. Reference sources for these guidelines are noted or prepared in the form of bibliography. 4. Normal values. The normal values listed are intended to serve as general guidelines or reference values. They are not meant to replace test norms provided by each laboratory. When available, values are given in both conventional and SI units. In an attempt to standardize the measurements worldwide, a system of international unit SI was developed. SI units have not yet become the standard in all parts of the world. Thus, both conventional units and SI units are included for all tests. Conversion factors for various laboratory components or compounds can also be found from many common websites. 5th, possible meanings of abnormal values. This section provides a compilation of conditions which may account for an abnormal test result. The lists are presented alphabetically to assist the reader in quickly locating the desired information. 6. Contributing factors to abnormal values. This will provide information regarding patient's condition, equipments or procedural peculiarities, foods and drugs which may affect the test results. Drugs are listed either as individual generic names or when an entire group of drugs is applicable as a broad classification. 7. Interventions or implications. These sections include the patient's education and preparations required during the pre-test period, the steps of the test procedure, and post-test care of the patient. Most procedures involve potential contact with the patient's body fluid. The institution's infection control policy regarding collection and handling of specimens should be reviewed and carefully followed. 8. Clinical alerts. We also need a listing in bold print the possible complications of the procedure. It also includes suggested patient's education, follow-up testing if needed, and applicable clinical tips from practice. 9. Contraindications. Contraindications meaning the listing of primary types of patients upon whom a particular test should not be performed. In addition, the healthcare provider must always assess the individual patient to determine the presence of other factors which may cause the test to be contraindicated for that particular patient. Next, approach to investigations. Why do we test? Patients seldom present to their doctor with their diagnosis, rather they have symptoms or signs. The major challenges in medicine is being able to talk to the patient and obtain a history and then carry out physical examinations looking for pointers to their likely underlying problem. Our elders, and some would argue, better in medicine, had fewer tests than we have today, and their diagnoses were often made solely from the history and examinations. Of course, they would claim that their clinical acumen and skills were greater than ours, and that we rely too heavily on the huge knowledge of laboratory and other investigations available today. This, in part, is probably true, but we cannot ignore the fact that advances in science and technology have spawned a bewildering array of very useful and sophisticated tests that help us confirm our diagnostic suspicion. By test, we mean the measurement of a component of blood, bone marrow, or other body fluid or physiological parameters to determine whether the patient's value fall within or outside the normal range, either suggesting the diagnosis or in some cases actually making the diagnosis for us. Factors affecting variable parameters in our health. Many measurable constituent parameters in our body vary throughout the life. For example, a newborn baby has an extremely high hemoglobin concentration which falls after delivery. This is completely normal and is physiological rather than pathological. This level of high hemoglobin in an adult would be pathological since it is far outside the normal range for the adult population. So, factors affecting measurable variance include age, sex, ethnicity, altitude, build, sampling method, storage and age of sample, method of analysis, physiological conditions such as at rest, after exercise, standing, lying, etc. Reference ranges or normal values. These are published for most measurable components of blood and other tissue, and we have included the normal ranges of most blood and cerebrospinal fluid (CSF) analysis. What makes a test useful? A really good test and one which would make us an outstanding doctor would be the one which would always be positive in the presence of a disease, and that would be totally specific for that disease alone. Such a test would never be positive in patients who do not have the disorder. What we mean to say is we are looking for sensitivity tests and that are also specific for a given disease. But unfortunately, most tests are neither 100% sensitive nor 100% specific. But we always have some which do come very close to that. It is important to decide which test will help us make the diagnosis. So, we should request those tests and review the diagnosis in the light of the test results. After that, we again review the patient and arrange further investigations if necessary. The downside of the test. It is important to remember that tests may often give normal results even in the presence of a disease. For example, a normal ECG in the presence of chest pain does not exclude the occurrence of myocardial infarction with 100% certainty. Conversely, the presence of an abnormality does not necessarily imply that a disease is present. This, of course, is where clinical experience comes into its own. The more experienced clinician will be able to balance the likelihood of disease with the results available, even if some of the test results gave unexpected answers. Sensitivity and specificity. By sensitivity, we mean percentage of patients with the disease and with whom the test is positive, while By specificity, we mean percentage of people without the disease in whom the test is negative. Quick fix clinical experience. In fact, this term simply does not exist at all. Talking to patients and examining them for physical signs and assimilating knowledge gained during medical schools are absolute requirements for attainment of sound clinical judgment. Those students and doctors who work from books alone do not survive effectively. It is a constant source of irritation to medical students and junior doctors when a senior doctor asks for the results of an investigation test, which is the one that cleans the diagnosis. So doctors learn a great deal by watching their seniors making decisions. This will form a basis of their own clinical experience. Laboratory error and how to avoid them. It is the fact of life that the sophisticated and automated analyzer in current use are not 100% accurate and 100% of the time, but they do come pretty close. In order to keep errors to a minimum, precautions need to be taken when sampling biological material such as blood. So, for minimizing spurious results using blood samples, we need to use correct bottles and other critical precautions. Try to get the sample to the laboratory as quickly as possible. Blood samples left lying around on warm windowsills or even overnight at room temperature will produce unwanted results. Conclusion. So coming to the conclusion, nowadays clinical biochemistry become an indispensable area of studies in every aspect of biological sciences. Especially with the increasing complexity of modern medicine, we need to understand the various issues related with clinical investigations. These days, we are routinely examining the serums and every other body fluid down to the level of individual nucleotides. At the same time, performing precise imaging through CT, MRI, and other imaging technologies are also equally important. To follow a specific and consistent format related to various laboratories and diagnostic tests now becomes mandatory. And following such formats helps the patients as well as the investigator in understanding the different factors affecting the variables and in proper diagnosis of the disease. Thank you.